There are a number of emerging imaging techniques for staging. So what you're talking about now is really taking patients who are high risk and staging. And there are really two ways to think about it. From the respective MRI, we're still very interested in determining whether or not something in the MRI, some quantitative signal, gives us a sense of which cancers are at risk for spread and which are not. There can be quantitative metrics of diffusion you can measure to try and help with that as an example. Thus far, we've not really seen that. And I think the future of that area will be combining the MRI signal with genetic findings in the tissue we sample, so that if you could create sort of what we would call a radiogenomic or radiomic signature, you might be able to predict just from the image who's at risk. We're not quite there yet with that. Where we are making advances that are more tangible to the patient is in the area of molecular imaging, PET. And when we fuse PET with MRI or fuse it with CT, we can localize PET signal to areas that would help us to identify oligometastatic disease, that might help us to identify the extent of metastatic disease at much lower PSA levels than we were previously.